Good afternoon, everyone. I'm going to be giving a very brief, what seems like a daily case report, and then elaborate on what the governor mentioned and Mayor Caldwell mentioned on our state of readiness as it exists today. Today, we reported 16 new cases of COVID in Hawaii. 2 are residents who are out of state. They happen to be in Nevada and Arizona, where there's a lot of illness occurring. They're there now and in isolation. 13 live on Oahu, and 1 lives on the Big Island. At least 6 of the cases here on Oahu were the result of our contact tracing, our identification of the cases and those who they were in close contact with, which I think exemplifies the efforts that are being made in this area. Hawaii continues to be in the enviable position as the state with the lowest number of cases per capita and the lowest number of deaths in the nation. Today, we had 38,000 cases of COVID in the United States. California alone had more than 7,000 cases. Florida had over 5,000. Texas had over 6,000. We had 16. I think it's a tribute to a lot of efforts that are being made and also exemplifies that we have been able to respond. Unlike many parts of the nation where the disease is raging, I see most people wearing masks at grocery stores, takeout food establishments, and standing 6 feet apart as they wait their turn. Businesses are renovating work areas to provide for physical distancing, installing plexiglass barriers, staggering work hours, and taking other actions to work safely. There are not many knuckleheads around that I see. Everyone in the state is working hard to keep our case numbers down, and we've seen great results because of that, and I appreciate all of your kukua. The 14-day quarantine on travelers has given our state the time to build our infrastructure, obtain personal protective equipment and other necessary resources, and to prepare effectively and efficiently to handle more cases. The Department of Health now has nearly 200 cross-trained employees through the state who may act as contact tracers in the event of a surge in cases. And in addition, the University of Hawaii is training another 300 applicants who will be able to assist with contact tracing by the end of July. Each of these individuals is able to track 20 people with the new applications that we have in place now. Many of the recently reported cases were uncovered through timely and intensive investigations by our contact tracing staff. Clusters of cases have been quickly contained through isolation and quarantine measures. Outreach activities in at-risk communities and care homes throughout the state have also helped in proactively identifying cases and increasing prevention measures. We have seen a spike in the number of cases over the last 2 weeks here, but nothing like what's occurred in other states. As the governor mentioned, we expect to see more cases as business reopen and more people move about. Today, we are much more confident in our ability to monitor for new cases and to respond quickly and appropriately to new cases than when this outbreak started. Our testing capacity at the 13 local laboratories within the state is between 4,000 and 5,000 tests per day. The turnaround time for tests within the state is usually within the same day on Oahu and the next day for the neighbor islands. When we started this outbreak, it took almost a week to get results often. We've seen a tremendous increase in laboratory capacity, and that's growing. Our state is currently using only about 25% of our available capacity for COVID-19 because illness rates are low at this time, but we have considerably more that we can bring to bear on the problems. This means we are prepared should we see a surge in cases or a large outbreak. Extensive testing has already been done in some care homes, medical facilities, family households, and that have positive cases, which has helped in identifying additional cases and isolate and quarantine individuals quickly. We realize that special circumstances can require isolation and quarantine to prevent the spread of disease, particularly in large families and congregate settings, such as care homes, prisons, and so forth. And facilities have been identified and established on all islands for this purpose. It's daunting to see the numbers of cases and deaths in many other larger states and the challenges that their healthcare systems are facing. We have been cautiously watching and learning from those states, including those in Alaska. The screening program we will be establishing at airports statewide will be the first of its kind for Hawaii. It is unprecedented, and we are on uncharted territory. There are certainly more details to be worked out, but we will have the opportunity to learn from other states and with our partners in the transportation and visitor industry. The airport screening and pre-travel testing program is just one small part of a statewide strategy to control and contain coronavirus in Hawaii. Perhaps the most important thing to remember is the most effective way to prevent the spread of the disease is for everyone to continue physical distancing, wearing masks when close to others, avoiding crowded places, and regular hand washing. That's what prevents the disease from spreading. It's also critical that people stay at home when they're sick, self-isolate, and call ahead to a doctor when they want to make an appointment. Closing, I want to appreciate the efforts of the people of Hawaii for staying the course and running this marathon as the governor's described it. We will continue to provide guidance, work with our partners in preventing the spread of COVID, and sharing information when it's available. Thank you very much.
Thank you, Dr. Anderson.